Okay, so for the ankle tape job, it's the first one we learn, and it's the one we use for your midterm because it's the most common tape job that you would do working with a sports team. Again, our ankle sprains are a very common injury. Typically it's an inversion sprain, but we'll learn the difference between our tape job for inversion versus eversion sprain. So our indications for an ankle tape job would be a mild sprain, a grade 1 sprain, and we're trying to return the athlete to game or practice that same day, or they've had a more serious injury and they've rehabbed and they just feel like they need a bit more support when they're returning to practice or play. Typically we will use the Tough Skin, the adhesive spray. We make sure they don't have any allergies to adhesives. In lab we don't use it just because it's a little bit messy, but normally you would use it to help the tape stick to the skin. And ideally the tape job should be right against the skin. If it's a person with a hairy limb, we'll use the Pro Wrap to protect it. And I'll put Pro Wrap on, and then we'll cut the video, I'll take it off and come back and start over without the Pro Wrap. So normally in lab you would use the Pro Wrap just for the first time you're taping, and then afterwards you don't use it again, because for the midterm you won't be using any Pro Wrap. We start with our heel and lace pads. We pull them apart. There's skin lube on one side, and we'll put it on the front and the back of the ankle. So usually I'll line the points up with the malleoli, and this is just area where there's lots of strips of tape that are going to be crossing over, and the tape can cut in on the skin. So the heel and lace pads help protect against that. For landmarking how high we go up, some people will talk about where the lower leg contours outwards. I'll usually use my thumb and index finger, so about 5, maybe 6 inches, and we'll measure up to here. So that's as high as we're going to go. With the Pro Wrap, it stretches, so we'll keep a stretch through it. And once we've gone around once, it's going to stick to itself. So we just overlap by half, working our way down towards the lower leg. And eventually it's going to direct itself down on the foot. So we just wrap around here. Okay. Now we proceed with the rest of our tape job as normal. So I'll pause the video and then we'll come back and I'll take all this off and we'll just tape directly against the skin, as you guys will practicing at home and as you will for the midterm as well. So we start our ankle tape job with our anchor strips. And we're gonna have 2 proximal anchor strips and 1 distal anchor strip. So again, for landmarking how high we come up, thumb, index fingers separate them to about 5 to 6 inches proximal from the malleoli. We're going to do our 2 proximal anchor strips. Now, if I try to go just straight around the lower leg, because of the contoured shape, the tape is going to be tight proximally, but it's going to be quite loose distally. So for our initial anchor strips, we're going to do what's called a teardrop shape. So starting on the anterior surface of the lower leg, we're going to start angling downwards just slightly around the back of the lower leg, and we finish angling upwards. So now the tape is tight proximally, but it's also tight around the lower leg distally. Our second proximal anchor strip, we're going to overlap the first one by half and follow the same shape, wrapping around. So there's our 2 proximal anchor strips. For the distal anchor, we're going to find the base of the 5th metatarsal. So I'll draw on here, right there. But to find it, if you just slide your finger along the lateral side of the foot, where it all of a sudden sinks in, that's going to be right in behind the base of the 5th metatarsal. And we want your distal anchor strip covering the base of the 5th metatarsal. Okay, so we're going to encircle the foot. Because we're wrapping around the foot, if we wrapped just normally, the tape would be too tight. Our athlete's not weight bearing right now, so their foot is relaxed. When they go to stand, the weight is going to cause their foot to spread out or splay, and the tape will be too tight. So we need to push up on the bottom of the foot to splay the metatarsals, so separate them, so the tape is not too tight. So there's our distal anchor. Our supporting strips for the ankle are our stirrups. And these are the only things that change between an inversion sprain tape job and an eversion sprain tape job. We're going to assume that Jen has an inversion sprain that's occurred, and we're trying to prevent inversion. To prevent inversion, we need to start our strips on the medial side, and we're going to come up the lateral side. Okay? So I'm attaching to our proximal anchors on the medial side of the lower leg. I'm coming underneath the calcaneus because we want to control the movement of the calcaneus. Remember, inversion, eversion happens at the subtalar joint between the calcaneus and talus. And then I'm coming up the lateral side of the lower leg. I'm going to tear the tape off to its correct length, and I'm just going to pull up slightly on the lateral side before I attach it down. We're going to rub the tape to secure it in place and warm up the adhesive. So that's our first stirrup. We're going to do 3 stirrups all together. The next one, I'm going to start just slightly anterior to my initial one, and then we're going to overlap underneath the bottom of the calcaneus, exactly where I did for my last one, and I'm going to finish just a little bit posterior to my original stirrup. So I started a bit anterior from my first one, and I'm finishing a little bit posterior from my first one. Our third stirrup, we're going to start now just a little bit posterior of the initial stirrup, overlapping by half, overlapping perfectly underneath the bottom, and I'm going to finishing just anterior. So you can see with our stirrups, the outline in red here is my first stirrup, starting on the medial side and finishing on the lateral side here. Stirrup number 2, we started a half strip width in front of the initial one. We overlap perfectly on the bottom of the foot, and we finish a half strip width behind the initial one on the lateral side. And then my third stirrup, we started a half strip width posterior. Again, we overlap perfectly underneath the bottom, and we end up finishing a half strip width in front of the initial one on the lateral side. Now we're ready to cover the stirrups up, and these are called our cover-up strips. The initial one, we're just repeating the original anchor strips again, overlapping by half, and we just work our way distal down towards the ankle. The shape of the lower leg is going to change, so at some point we're going to be able to stop doing our teardrop shape and go more cylindrically or straight around the lower leg. And then as we get down towards the ankle, the bottom of the lower leg, it's going to start to get wider again because of the malleoli on the tibia and the fibula. So we're going to start doing a reverse teardrop. So our teardrop, we started angled downwards and we finished angling upwards. Our reverse teardrop, we're going to do the opposite. We're going to start angling upwards slightly. We're going to wrap around the back and we finish angling downwards. We overlap by half again, wrapping around the back and finish angling downwards. And then our final one, we come as low enough so that our last reverse teardrop starts and finishes on your distal anchor. So here's our distal anchor here. We started, we wrapped around the back, and we finished down here. Now we've got this window on the bottom of the foot. We need to cover that up before we move on to our heel lock. So windows is where you can see right through to the skin. The shadow is where the layer tape is only 1 layer thick. So to cover up our window, we're just going to do some mini stirrups. So we don't need to come up as high as our regular stirrups because we're not trying to support the ankle. We're just covering up that exposed skin. So only as many mini stirrups as you need to do. And now we're ready to do our heel locks. This is where people get confused because the tape is wrapping around at different angles around the lower leg. For that reason, it'll be good when you get your own tape to double the tape back on itself and create this strip of tape that's not sticky on either side. And you can use it to practice the path of travel for your heel locks. And then once you've got the path of travel down, then you can practice it for real without burning through a whole bunch of tape while you're trying to learn where the tape is going. So we're gonna be doing 4, they're actually half heel locks, 4 of them all together. Later on when you're working with a sports team and you're more comfortable, you can combine the half heel locks together into a full heel lock, but we're just gonna be doing half heel locks. And like I said, there's 4 and you're gonna alternate which side you start on. So I'm gonna start on the lateral malleolus. We always come up over the dorsum of the foot and underneath the bottom. But as I go underneath the bottom, I'm not going straight underneath the bottom of the foot. I'm heading back around the back of the heel and around the back of the Achilles, and we finish back where we started. Now, you might finish a little bit above the malleolus where you started. You might finish direct. Any of that is fine. I just don't want you finishing way up the lower leg with your heel locks. That's too high. You should be back in the general area where you started. So that's one half heel lock. Next one, you would start on the medial malleolus. You're still coming up over the dorsum of the foot and underneath the bottom. And again, when I go underneath the bottom of the foot, I'm not going straight underneath the bottom. I'm angling back towards the heel, wrapping around the back of the Achilles, and finish back where we started. Okay, so I'm going to do it for real, and then we'll draw on the tape the path of travel. Athletes got to keep their ankle in neutral position. So starting on the lateral malleolus, over the dorsum of the foot, underneath the bottom, wrapping around the back of the Achilles and calcaneus, and we finish back where we started. So with my black marker, this is where we started, underneath the bottom. Okay, I'll grab the phone. So we started at the lateral malleolus, over the dorsum of the foot, underneath the bottom, and as I went to underneath the bottom, I angled back towards the heel calcaneus. We wrap around the back of the calcaneus and Achilles, and we finish coming up around towards the lateral malleolus again. So that's one half heel lock. That was starting from the lateral malleolus. My next one, we start from the medial malleolus. Again, over the dorsum of the foot, underneath the bottom, angling back towards the heel or calcaneus, around the back of the calcaneus, and we finish back where we started. So with our red pen this time, start on the medial malleolus, over the dorsum of the foot, underneath the bottom, around the back of the heel or calcaneus, and we finish back where we started. Okay, so we started on the medial malleolus. In red pen, you follow the path over the dorsum of the foot, around the lateral side of the foot, and underneath the bottom. And as we go underneath the bottom, here is our path of travel, and around the back of the heel calcaneus, and we come up over the front of the ankle back towards the medial malleolus again. So that's 2 half heel locks. We need to do 2 more. So I'm going to go back to the lateral malleolus, starting on the lateral malleolus, over the dorsum of the foot, underneath the bottom. And this is usually where people run into trouble with getting wrinkles. So you can manipulate the path of travel somewhat by pulling on the tape slightly one edge or the other if you're not happy with the direction the tape is going. You want to make sure you're continually pulling tight as you apply the tape. We wrap around, finish where we're going. You only want to unravel the tape as you're applying it. You don't want to pull a whole bunch of the tape out and try to put it on, or it's going to wrinkle on you for sure. We've got one more half heel lock, starting on the medial malleolus, over the dorsum of the foot, underneath the bottom, wrapping around the back, finish back where we started. Okay. So now we look all around our tape job and we look for any shadows or windows. So shadows is where the tape is only 1 layer thick Right here I've got a shadow, and a window would be where we can see right through to the skin. And we want to cover those up with mini strips. Now you might not have any and you're nearly done your tape job, but if you had a shadow like I do here, we're just going to wrap around, and because we're encircling the foot, I'm going to push up on the bottom of the foot to display the metatarsals. If you had a shadow or window here, you do one of your mini strips again. You just want to make sure that this time you're coming up high enough that you can do one last strip of tape around to secure that mini strip in place. If it's a window, you need to do 2 mini strips on top of one another, so we have 2 layers of tape thick. If it's just a shadow, you can do the 1 layer tape. And then the last thing that we'll finish off is just repeating our distal anchor, displaying the foot. Now, normally we would have the athlete hop down, walk around. It's going to restrict their movement, which is what we want. If they feel like it's too tight, we'll have them go warm up, because the tape will loosen off a bit after running or jogging for 5 or 10 minutes or so. If they still think it's too tight, then we'll take it off and redo it, but I would err on the side of being too snug rather than too loose. For getting the tape off, we talked last week in the first lab about different options between the shark and our tape scissors. You want the athlete to remove it, not you removing it for them. And the easiest way, if we draw a line straight down the lower leg, actually we'll show it on this leg if you want to cross that over. On the lower leg, we want to cut a line straight down the medial side lobe behind the medial malleolus towards the opening at the heel, and then straight along the heel. There's a lot of soft tissue here, so it's not going to compress the bone as you cut the tape off, and then all the tape will peel off as a cast. Assuming you don't have a shark or tape scissors at home, don't try to use regular scissors to take it off. You will cut yourself, so just peel your tape off strip by strip from your family member or whoever you do the tape job on.